Hey hybrid students, this is Dr. McGuire, and what I'm going to do in this video is I'm going to go through your course syllabus for ADN 210. So about now you guys are probably getting pretty tired because you've been going at it pretty hard for the last several months. So this is kind of the last class before you guys get a nice little break before you start the last half of this program. So I get it, I understand that you guys are exhausted, but you got a little bit more work for me still before we can, call it quits on this semester. So GIGU, it's got a lot of content in it. So I'm hoping that the way that I've got it organized for you guys that it won't be too cumbersome. But I just want to kind of give you guys a heads up that this tends to be a lot of content in a very short amount of time. So here's the syllabus. Let's kind of go through this. We've got class. We're going to meet every Tuesday night from 5:30 to 8:30 p.m. The plan is going to be in G216 in the lab if necessary. But again, you guys know how things work. Sometimes, we'll be as flexible as we need to be. Okay. There's me, my office. I'm G218B. If you guys need to get a hold of me, the easiest and best way to reach me is going to be through my email. I usually answer my emails in under 24 hours. If you leave me a message on my phone, it might be days before I actually see it. Okay, so please make sure you guys are using my email. Clinical faculty for this, beside myself, will be Summer Kane, Ms. Kane. You guys can get a hold of her the same way through email, and then she may have a different way for you guys to get a hold of her for clinic purposes. And then, of course, my clinic group, I will give you guys my cell phone. I do not want you using my cell phone for anything other than clinic related. All other inquiries should be done through my email. Textbooks. Again, you guys know that I tend to put all the textbooks in here. I've got your Ackley and Ladwig, that's your nursing diagnosis book. Adams, that's your pharmacology book. You should be using that in conjunction with the body systems. Your ATI med-surg book, along with the ATI practice test. Your HESIs, which are the from the Evolve site. Hoffman and Sullivan. I still have the first edition listed here, but guys, the second edition is out there, and I find that that's mostly where I'm finding most of the information is through the second edition. But if you guys have the first edition, second edition, I really haven't seen that much difference in the two books. So they're both equally, they're basically the same book, okay? Pagana and Pagana, that's more for clinical, that's your diagnostics lab. And then your Davis Drug Guide for clinic as well. Prerequisites for this course, obviously you have to be enrolled in the class. And then you only have had to completed ADN 203 or the equivalent of ADN 201 in the face-to-face program. In the program student learning outcomes, I'll let you guys kind of go through those on your own. We have all the same student learning outcomes that are going to be geared towards the specific body systems of GI, GU, and reproductive. Okay, here's where you're most concerned. Here are the chapters that I'm going to be covering in the next few weeks. So soak it up, guys. There's a lot of chapters here. So we're going to talk about obesity. We'll talk about GI function. Your book talks about like oral and esophageal in one chapter, stomach disorders in another chapter, intestinal disorders in another. I tend to do GI a little bit differently. I like to do it more as upper GI stuff and then lower GI stuff. But again, it should correlate with your chapters just fine. It's just when I've taught it in PN level, I just tend to organize it that way. So that's actually how you'll find my PowerPoints. But like I said, it should coincide with the book. I've got it all organized for you by how it's supposed to be in the book. GI accessory organs, those are going to be your liver, your gallbladder, and your pancreatic disorders. So that's actually where I'm going to be doing your first exam from, and I'll show you guys that content in a little bit. GU, you've got, your assessment chapter, and then you have your renal disorders and your urinary tract disorders. Again, your book separates them. And then finally, we'll wrap up the semester with reproductive chapters. So you'll have assessment of reproductive function, female, male reproductive disorders, and then your sexually transmitted infections. So guys, we're looking at a lot of chapters in a short amount of time. So we saved one of the big ones for the end of the semester, okay? So it's a lot of info. So again, I want you guys to take this seriously. and make sure you guys are not getting behind on the reading, because like I said, you get behind in this course, it takes a lot to get caught up. So here's how we're going to do it. We're going to start with module 1. Like I said, I like the GI accessory organs. I feel like they're a little bit easier to understand. So I went ahead and put those first. So we're going to start off with obesity, and then we'll do GI accessory. So GI accessory is going to be your liver disorders. So we're looking at, hepatitis, cirrhosis, liver cancer, liver failure. And then biliary and pancreatic disorders, we're looking at gallbladder issues, pancreatic issues like pancreatitis, pancreatic cancer. So again, me personally, I just feel like those are a little bit easier to understand sometimes. So I wanted to do those first and kind of start off with those chapters. Here's your ATI resources, and then I've got your assignments down here. You've got a weekly discussion board, which you should be able to link from the D2L course. You've got Evolve Case Studies. I've got them mapped out for you. And then you have an online quiz for me, okay? Now, for the very first quiz, okay, GI accessory and obesity is actually quiz 2, okay? I don't want you to get confused here. Quiz 1 is going to be over this syllabus, okay? So everything that I'm covering in this video, everything that is on my syllabus is what's going to be for quiz 1. You have like two days to get that quiz done. And then you'll have the entire week of week 1 to get the GI accessory and obesity, okay? So you technically have 2 quizzes in the first week, one over the syllabus, and then the GI accessory and obesity will be open until Sunday night. Okay, so please make sure that you guys are getting the dates correct. I should have them in the calendar for you, but I want to make sure that you guys are not going to miss those 2 quizzes. All right, the first official lab is November 16th. You guys will be finishing up neuro. You don't have to meet with me that night because that's what this video is for. Okay, I'm actually not there, and I was going to have somebody sub for me, but I heard you guys have a speaker coming anyway, so this actually is going to work out really well for all of us. So as soon as neuro is done and you guys are let out, you get to start on 210. Okay, so the orientation video, this is it, and you can start working on your stuff beginning on Monday if you want. Okay. Exam 1, which again, that'll be on lab 2, okay, November 23rd, that's going to be GI accessory and obesity, okay. So after we finish up the accessory organs, we're going to move into the GI, actual GI chapters. So that's going to be your assessment of GI function, oral esophageal disorders, that's going to be like oral cancers, stomatitis. Esophageal disorders are going to be like your reflux, your esophageal cancer. Stomach disorders, we're looking at, peptic ulcer disease, stomach cancers, and then the intestinal disorders, that's going to be like all the irritable bowel syndrome, Crohn's disease, ulcerative colitis, colon cancer. I mean, the list goes on and on with the amount of GI material. So, like I said, I have taken the accessory stuff out of there, so hopefully that will just limit you on just the basic GI tract. So I'm hoping that that's going to make this a little bit easier rather than giving you just one massive GI test. It's kind of split up into 2. So I hope this works out better, and I'm really optimistic for scores on splitting it like this. Again, weekly discussion you'll have, Evolve Case Studies, online quiz for GI disorders. Okay, so again, this is how the schedule goes. Module 3, again, we will be going into the renal system, discussion board. There's your exam 2 for your GI disorders. And then the final module we're going to do is going to be reproductive. Reproductive chapter is a lot about cancers. So we're talking like breast cancer, uterine cancer, ovarian cancer. It's a lot of the cancer disorders. There is a little bit of menstrual flow disorders, but a lot of what we're going to talk about in these chapters are going to be cancer related. And then of course, the STIs will also be in there. For your discussion board, for your final discussion board for this class, it's a nutrition presentation. I've got the template in there for you. You can see what I'm looking for. I will help you guys pick the diets. Each person's going to do their own individual diet presentation or nutrition presentation, post it into the D2L, and then you'll do it like a a discussion board. So you'll watch another person's video and you'll make comments based on it. Reproductive disorders quiz, you can actually cross that out because I decided after I posted the syllabus that we're not going to do one. And here is why. On December 7th, what you guys are going to do this night is you're going to come in and you're going to take your GI final, okay? Exam 4, as soon as that GI test is over, I'm going to hand you exam 4, which will be the reproductive one. And you will take that as an in-class exam during the lab period. So yes, December 7th, you will take 2 exams, okay? But exam 4 is going to be as a group with your books, with your resources. You will take it together. We will get it done before you leave that night. And what that does is that leaves you 1 week to really focus on your nutrition presentation and that proctored ATI nutrition exam, okay? I thought that was the best way to outline this course. So one of your exams is an open book test, okay? So I'm hoping that takes a little bit of pressure off of you guys in terms of going into this ATI. And I really, really want you guys to do well on this proctored nutrition exam, okay? Your nutrition exam is going to be on December 14th. That's the very last night of this class. I've already got your room booked. It's an E132. You have to have practice A and B done at a 90% before you can even be admitted into the exam. You have to get a level 2 or higher. If you do not achieve a level 2, we will schedule it individually. It'll probably have to be in January at that point because the college will be closing 3 or 4 days later for the Christmas break. So we'll cross that bridge if we need to, okay? But I'm giving you guys plenty of time to prepare for this nutrition ATI. Okay, method of evaluation for this course. So there's 4 exams, 80% of your grade, one of which you're taking as an open book, okay? So again, a little bit of pressure off there. Quizzes are going to be 10% of your grade. HEI Case Studies are 5%. Your discussion boards are 5%. Your clinical, you have to pass, you have to get a score of 90% of the points on your clinical evaluation tool. And then your ATI nutrition, you have to have a level 2 or greater. That's how you pass my course. For the discussion boards, okay, discussion boards open on Monday. They close on the following Sunday night at 23:59. There are a total of 4 discussion boards in this course. Here's what you do. You respond to the discussion board with an academically thoughtful post during the assigned week, okay? You make 1 post, and then you reply to 1 other student for a total of 2, okay? Your initial post needs to be, and I got this from Dr. Yosanovich, guys. I apologize because I know you hate this, but I want thoughtful posts. I want the initial post to be a minimum of 300 words. A reply is a minimum of 150 words. So you cannot get away with saying, I agree. Okay, I want thought-provoking, okay? And you're only responding to 1 other person, okay? Content's relevant. I want grammar, spelling correct. Initial posts, I want done by Thursday night. And then that leaves you guys the weekend to get your responses done. So I want everybody's initial posts done on Thursdays. And then you've got Friday, Saturday, and Sunday to respond to 1 other person, okay? And this is how I'm going to divvy up your points, okay? It's pretty simple, not too much there, okay? To successfully pass my course, you have to have a 78% cumulative grade. Exams all have to be above a 70%. You must pass the clinical at a 90%, and you must pass the nutrition ATI, the proctored exam at a level 2 or greater. Clinical obligations, any clinical absence will be handled on an individual basis, especially because of COVID regulations. Guys, we will look at it on a case-by-case basis, okay? But for my group, it's only 2 days, okay? So if you miss a day of clinic, that's 50% of clinic. It better be, we're going to have to make it up some way. I can't just excuse a 50% miss, okay? So again, I hope you all take clinic seriously and that you will all attend clinic. But if something does happen, again, we will look at it on a case-by-case basis, and Dr. Yosanovich and I will come to some kind of agreement on what we're going to do for any makeup if necessary. For the exams, if you are absent from an exam, I will automatically take a 3-point penalty on the exam. I have and will give an alternate test format of any makeup exam needed. So if you can't be there, do not expect to take the same test as your friends. You will be allowed to make a score between a 70 and a 77 as long as your final overall grade is 78 or greater. If you score between a 70 and a 77 on any exam, you must complete an action plan and submit it to the Dropbox. Okay, and I've got the forms in there. Any score below 70 on any of the exams will result in an automatic failing grade for ADN 210. This is not anything new. Okay, I just want to reinforce that. All exams and final grades will not be rounded. Okay, so again, you get a 77.6, I will report it as a 77. If there is extra credit in the course, you cannot use it to bring a failing grade to a passing grade. Okay, I do not plan on giving you any extra credit, but if for some reason I do, you cannot apply it to help you pass. Exams will be scored and posted within 7 days. I'll let you guys know when exam viewing times will be. In terms of if you are COVID positive or quarantined and unable to campus or come to campus, I will do my best to use Teams, and I have this in my syllabus as well. I do have the right to administer an alternate format of the exam for any absence. Okay. Action plans, here is the rules on action plans. Again, this shouldn't be anything new. This tells you I need an action plan. If you do not complete an action plan for me, you'll get an incomplete in the course, okay? And I do reserve the right to not allow you to sit for the next exam if you don't submit an action plan. An action plan is not meant to be punitive. It's meant to help you prepare and help you better improve your study skills for the next exam. For Microsoft Teams, okay, it will be attempted only for students who test positive for COVID-19 or have been quarantined by the IDPH, okay? If you don't feel like coming to class and you just want to sit at home, I'm not turning on Teams for that, okay? I'm only going to utilize Teams for testing positive or notification of quarantine. And you need to make sure that I know at least 2 hours prior to the start of class time, and I need a copy of the notification email, okay? Otherwise, Teams is not going to be utilized for any other absences. ATI, I've got all this stuff in here about ATI. HEI case studies, this is something I get a lot of questions on. They will be computed using the highest grade earned on each case study during the assigned week, okay? If you do them early, it's a 0. If you do them late, it's a 0, okay? If you do them during the assigned week and you stop at a 90, I will record your score as a 90, okay? So again, please make sure with the HEI case studies, you can take them over and over and over again during the assigned week. You can take them over until you get 100%. If you do them early though, it will count as a 0. If you do them late, it will count as a 0. So please make sure you guys are following the schedule and doing them during the assigned week. Quizzes, you're gonna have an online quiz every week. I do not do makeup quizzes. They'll be open Monday to the following Sunday. And again, 10 questions. They're multiple choice or select all that apply usually. You get 1 attempt, okay? 12 minutes is how long I give you. And again, they're not overly difficult quizzes, but I do expect you guys to be academically honest. I expect you guys to do your own work. So for the quizzes, they will not be scored until everyone's taken them, and then I'll post the scores afterwards. Okay. That being said, academic dishonesty, again, guys, we don't condone cheating, plagiarism, fraud, misrepresentation, theft, anything, okay? It's unacceptable behavior. So I just want to make sure that we reiterate, I understand this is an online course, but I expect you guys to do your own work, okay? I expect you guys to be professional, okay? In the classroom and in the clinic setting, okay? So again, please make sure this is not new stuff, guys. This is all old stuff, actually. So I just want to make sure that we're all following the rules. I know we all are really, really tired by the end. I'm right there with you, but we got one big push left, okay? So let's finish this strong, and let's go into Christmas break, you know, with everything in good graces. Okay, so what we have this week. So as soon as you watch this video, I suggest you take the syllabus quiz. It's only going to be open for a couple days, and then get started on those GI accessory organs, okay? If you guys have any questions, If you have anything that you need to get a hold of me for, please email me. I'm usually very, very good about answering my email. Um, I will try to answer all emails, especially next week in under 24 hours if you guys have it. If I don't hear from you between now and then, I will see you guys on the lab night where we take our first GI exam. Okay, thanks, guys. Talk to you soon. Bye.